Hey everybody, Tyler Finken here with Western Marketing, coming at you again with my buddy over here, Andrew Rodman. We recently did a video on hospital indemnity plans and a shocking revelation that we recently came across. And this is just kind of a follow-up video to that. So for those of you that may or may not have seen it, we were recently at a meeting and the stat came out that less than 1% of Medicare Advantage enrollees actually have a hospital indemnity plan. And to kind of go over some facts that we went over on the last video, there are an estimated 30.8 million Medicare Advantage members, of which less than 1% have hospital indemnity coverage to help cover those copays and everything. And what we wanted to do in this video is kind of show you how to initiate the conversation with your Medicare Advantage clients to help enhance their coverage and give them a hospital indemnity plan. So we've got our resident hospital indemnity expert, Andrew, on with us today. And Andrew, I want you to go over a little bit about how people can initiate the conversation and how to go through that presentation.
Absolutely, Tyler. Thanks again, and looking forward to you guys seeing this video, and I hope it really helps you guys. So we're going to kind of go over just why, when, and how we're going to market a hospital indemnity plan to your client. The set the stage in the scenario is basically you have that appointment for a Medicare Advantage. You've got the scope of appointment completed. You're compliant with that time frame, and you're sitting down with your client. So why, when, and how. So once you go through your presentation and whatever the Medicare Advantage plan is, we've got to go through and do a compliant presentation with your client, number one. And number two, when we go through the benefits, some of them are really, really beneficial to your clients, whether it's extra dental or OTC or wherever it might be. But when you start reviewing some of these kind of maybe negative things that come along with a Medicare Advantage plan, such as these copays, this is where you're going to set the stage. This comes from a screenshot from our Medicare Center system where we can pull all those copays, deductibles, and benefits directly from it. So as you can see here in this specific plan, the inpatient hospital copay is $400 a day for days 1 through 5. So we're looking at a $2,000 bill there. Inpatient mental health, skilled nursing facility, that's $203 for days 21 through 100. It's a pretty big chunk of change. Ambulance services, ER, occupational therapy, physical therapy, chemotherapy, and radiation, which is a 0 to 20% co-insurance. Some pretty big holes there. When you go through and you are talking to your clients about that, you can kind of see their eyebrows raise, saying, "Hey, that's a concern." So what we're going to do is through that presentation, when you see these copays, you're going to use this down below. Take a picture of it with your cell phone, or we can send you a recording of this as well. Mr. Jones, I know all these copays may be a concern for you. Not to worry. I have a plan specifically for you that will help give you the peace of mind and cover most of these copays. I just need your help to remind me to enroll you in it before I leave today. Can you do that for me? So we're putting a little responsibility back on them to kind of give you a reminder. Of course, you're not going to forget, but if you do, hopefully they do remind you. It sets the stage that, hey, yes, there is copays. When they go and utilize this plan, they are going to have a copay, but we have something that can help fix that. Okay. And of course, that is a hospital indemnity plan. So we have a lot of different hospital indemnity plans that are out there, but we wanted to show you basically one tool that is going to be at a resource for you for filling the gaps. And it is basically through our CSG actuarial. There's a nice little QR code down at the bottom that you can see a full live demo of that. So if you want to, go ahead and take your phone out and check that out as well. But what this does for you is makes your life easy when you get done with the presentation to go in and actually compare side by side your Medicare Advantage plan on one and your hospital indemnity right over. And it's a real simple click-through process where you can match up those copay days or those copay amounts, and then you can basically PDF that out and bring it along with you in a presentation or send it to your client via an email. So one of the tools that's super easy for you to be able to fill those gaps in coverages, come up with a quick premium, and complete the enrollment. So with that being said, it's pretty short. It's sweet. How, when, where, it's during your Medicare Advantage appointment. You need to make that a part of your process to bring up that there's holes in coverage, but you have a solution for those holes in coverage, which is a hospital indemnity plan. utilizing our tools and your resources that we have here, you're going to be able to quickly, efficiently do that. So if you want to get a hold of us, you can actually take a little scan there with your phone on that QR code to be able to get more information. Otherwise, you can call our office at 800-852-7152. Ask for Tyler or myself or anybody else on the health team. We're here to help you. Thanks for joining. Appreciate you.